Hello, educators, and thank you for joining me for Educating Students with PTSD. Over the next 10 minutes, I will run you through the history of PTSD, diagnosing the criteria for PTSD, the assessment process, a trauma-informed school approach that will be an intervention for PTSD students. Lastly, we're going to close with tips for teachers during the COVID-19 pandemic. I think it's important to provide some general background information on PTSD to get started. So here we go. In 1980, the American Psychiatric Association first formulated the diagnosis for PTSD. In this year, the APA did not believe that PTSD would be relevant in children. That would soon change, though, with research. So from 1979 to 1983, Lenore Tur studied a group of kidnapped and held hostage children. And then Tur's research that followed sparked the acceptance that PTSD was, in fact, possible for children following a traumatic event. And let's quickly go through the criteria that it takes to meet PTSD in a patient. So the first, and I want to note as we go through these, that the fact sheet, the fact packet that follows is going to have a lot more information following not only the criteria, but a lot of what we have following. So make sure you check that out at the conclusion of this infomercial. Okay, so to the criteria. The first one is the stressor and the most important. Without the traumatic event, the stressing event, PTSD would not be possible. So the next criteria would be intrusive recollection or PTSD flashbacks. This is signifying that the trauma remains and can often cause panic, terror, or even grief. The third criteria would be avoidance, and that's the patient's strategic behavioral move for not being re-exposed to the stimuli with the trauma. Then we have negative cognitions or mood as a criteria, and that is just the alteration in mood and seeing after the event, since that event, kind of the deterioration of the patient's mood. And then we have alterations in arousal and reactivity, and these resemble panic attacks or anxiety disorders associated with PTSD. Next, we have duration, and that's that these symptoms persist for at least a month. There's functional significance, and that is social or occupational distress. So for students, that's their schoolwork, reducing in quality or not, completing it or having trouble with those friend groups that they prior hadn't. And lastly is exclusion, and that's just ensuring that medications or substance abuse is not the reason for these symptoms. And so these were all the criteria for adults, and the criteria for children almost completely reflect these. They're just more condensed and also found in the facts packet. So now let's move on to assessment for PTSD. And it's important to note that as we cover the assessment tools, the screenings and the interviews, that they don't pertain to students under 7 most of the time. And their relevance for research. That's because children at these young ages have trouble self-regulating, and it's difficult to kind of comprehend their own emotions and express those. So a lot of the studies have been with children above 7. And while the screenings are no longer popular, I think it's important to mention them. The most used screening would be the PTSD scale for children. And they've also have the impact of event scale, that is an adult scale that was altered for children from 13 different criteria to 8 that have to be self-rated. But more popular now are kind of structured interviews. And these interviews are done by a clinical professional, and they're looking for the patient to describe the traumatic event and the feelings that followed in these interviews. The interviews in that first meeting really lay out to this clinical professional the interventions and supports that could possibly be needed for the student. It's also been researched that drawing for children is a beneficial way for them to express their emotions, and really, it may be too difficult for them to talk about, but it may be easier to draw it. So I want to move on to what you can do. We know the criteria for PTSD, how to get that criteria assessed, and now what, as an educator, you can do. And what we can do, and what we're going to look at today is trauma-informed schools as an intervention. And as we rounded towards the millennium, 1998, it really became prevalent. The impact of PTSD became more understood than it had in 1980 because we were researching more of it and getting a better understanding and foothold of the effect of PTSD on students. So in a trauma-informed school, there are outcomes that the school is looking for. And it's a school-wide approach that is, going out to prepare students and staff for dealing with PTSD. The first outcome is prevention. We want to provide a safe environment. We'll talk about that soon. The next outcome is practicing self-regulation tools. Third would be assisting individuals who have or are dealing with PTSD. And then the last one would be avoiding re-traumatizing these students. And so these outcomes are aligned with a multi-tier framework, similar to like a PBIS framework. So the first tier is to support all students through a positive environment and these resilient skill buildings and self-regulation tools. The second tier would be acknowledging that some students will experience challenges. And the third, that they're going to need support from educators. So for educators, following the 4 R's will result in becoming trauma-informed. And so I'm going to go through those 4 R's quickly. The first R is realize. You have to realize the impact, the widespread impact of trauma, and also the pathways to recovery and the interventions to recovery. Then we're going to recognize the signs and symptoms, not only in the student, but the family, maybe the staff that works outside school, recognizing that something isn't right. Then responding, we need to ensure that it's a school-wide knowledge of policies, procedures, and practices so everyone is on the same page. And then everyone as a whole needs to help to resist the re-traumatization. Okay, so now we're going to turn to something more present, and let's talk quickly about supporting students with COVID-19 that have PTSD. So for many during the pandemic, it compounds the effects of PTSD. There's an increase in neglect, hunger and abuse, and isolation. Not only those, but educators are limited to the services that they can provide not being in schools. So there was some research done, and it comes from the Appalachian region in our country, where approximately 170,000 children experience a range of stressors from parents' opioid abuse. So this organization, REL Appalachian, worked with stakeholders, local agencies, schools, universities, and they came up with this list for teachers to follow to help them support students with PTSD or other trauma. So the first one is providing structure and routine. That's going to take collaborating with families, parents, and making sure the student's organized. The next is going to be promote a sense of control. Well, give that student a sense of self-control, not only self-control, but the ability to have control over their day. This next one is very important, being present. Whatever your mode of communication is through this, you have to be there for the student. And as a special educator, that goes without saying in our profession, but in this time, it is even more important that we're there if we can't see our students face to face each day. We need to provide emotional check-ins when we're working with our students and communicating with them, whether it's when you get in or out of class, just to make sure we're up to date with how the student's doing. And then the reoccurring theme of strengthening self-regulation skills. We've heard that one before, and it is always important. So as we conclude, it is possible for students to recover from PTSD through intervention and support, but it's not easy, as we can see. It is vital for students with PTSD to have a school environment that is prepared and knowledgeable. Schools have a plethora of professionals to deal with trauma, and it is an ideal place for students to cope and recover. This concludes the infomercial on educating students with PTSD. Please revert to the facts packet for more information and additional resources to continue your own research. Thank you all for your time, and have a good day. Thanks.